Hello and welcome back to Curbside Ethics. I'm Dr. Steve Bradley, your host. I am an anesthesiologist and clinical medical ethicist. Today, I am excited to talk about this subject matter. I have been tracking this for over a year and specifically looking at the rise of the vaccine mandates. We knew it was coming. I know a lot of people were thinking more about how to manage COVID-19, SARS-CoV-2, the pathophysiology over the last year. As these vaccines were developed, they brought with them new ethical considerations and how they would be first distributed and now mandated or strongly suggested, depending on how you look at it. It's been in the press a lot over the last couple of weeks and the last month. We're going to talk today and review some of the literature and the data and the policies on vaccine mandates. Are they legal? Are they ethical? Are they a good idea? Will they help people get vaccinated? Will it hurt the process? So I've read quite a few articles on this subject over the last week to kind of brush up. Excited to jump in, so we'll get right to it. Briefly, in my opinion, are these vaccines ethical? Yes. Are they legal? Yes. I'm not a lawyer, but I was able to read several articles written by lawyers and review some of the state policies, the federal policies regarding mandates for vaccinations. Additionally, we'll get into this a little later. If you have any questions at all, you can always go to the Equal Employment Opportunity Commission's website, and they have a whole page dedicated to COVID-19 and vaccines. And you can see exactly what's legal. There's a lot of misinformation, no shocker, that's been circulating online and social media, and people are really concerned about these vaccine mandates. But before you start protesting and burning bridges, you really want to know what is legal. Do you even have a court case to protest whatever it is that you want to protest, and proceed from there? Because you probably already signed some documents and you probably already agreed to some stuff, and you need to know where you stand. So when it comes down to, are vaccine mandates legal? Yes. If you look at the Equal Employment Opportunities website, they again have a whole list of information and policies regarding what employers can and cannot mandate. The precedent has already been set with regards to immunization records. I know people like to use this term, vaccine passports. Immunization records is something that has already existed and that we all have already in some form, whether that's mandating the annual flu shot or measles or the hepatitis B vaccine. Most healthcare systems already have these mandates in place. It does not come from the federal level. There's no federal mandatory vaccines at this point in time. However, states, universities, other government organizations have their own mandates and things that they require for their employees. In most states, a condition for entry into the school system for children is to have certain childhood vaccines. There's about 15, 16 states currently that require flu shots and hepatitis B vaccines for various lines of employment. So the precedent is already out there. It's already been set. And if you haven't run into it yet, then you probably haven't worked somewhere that has had that mandate. That's all. And so there is a subjective component to it. I was online talking, there was a paramedic who said he'd never had a hepatitis B shot required for his line of employment. Okay. For all the hospitals that I've ever worked at, I have had to produce an immunization record and show that I was vaccinated for hepatitis B, that I was negative for tuberculosis. So hospital systems and individual companies already have these mandates in place. From a federal perspective, state and local government, they hold the reins and they control what is and is not required or mandated. With the introduction of these vaccine mandates, or specifically these COVID-19 vaccine mandates that are on the rise, there's different states that are starting to launch legislation for different purposes, whether it's anti-discrimination, to try to prevent organizations from requiring these vaccines. And, time will tell. We'll see what this legislation comes and results in, whether it goes to the Supreme Court and there's a decision made from on high. But currently, there's not much of a legal standing for these discrimination lawsuits. If you go, again, to the Equal Employment Opportunity website, you will see that there are already stipulations in place for people that have some underlying condition or belief that precludes them from receiving the vaccine. So again, I'm going to go straight to the page. It says what you should know about COVID-19 and the American with Disabilities Act, the Rehabilitation Act, and other equal employment opportunity laws. And they have this whole table of contents about what is required to keep your medical information confidential. Spoiler alert, HIPAA does not apply to your employer asking you if you're vaccinated or not. The Health Insurance Portability and Protection Act specifically talks about what a hospital and other covered entities have to do to protect your privacy. So your employer asking if you are or are not vaccinated does not violate HIPAA. It doesn't violate your personal privacy. If you don't want to answer your employer's question, you don't have to answer the employer's question. It is a consensual relationship. And just like it comes down to most things with ethics, you can do pretty much whatever you want to do, but that doesn't preclude you from the repercussions of your actions. So depending on your interaction with your employer, it may go well, it may go poorly. You may need to find a new employer. So straight from the EEOC's website regarding the confidentiality of medical information. So the question, it's all in a question and answer format. Questions like, may an employer disclose the name of an employee to a public health agency when it learns that the employee has COVID-19? The answer is yes, per the EEOC. When it comes specifically to vaccinations, this is, again, straight from the Equal Employment Opportunity Commission's website. The EEOC has received many inquiries from employers and employees about the type of authorization granted by the U.S. Department of Health and Human Services and the Food and Drug Administration for the administration of 3 COVID-19 vaccines. These 3 vaccines were granted emergency use authorization by the FDA. It is beyond the EEOC's jurisdiction to discuss the legal implications of emergency use authorization or the FDA approach. Individuals seeking more information about the legal implications of emergency use authorization or the FDA approach to vaccines can visit their webpage. Their jurisdiction is limited to the federal EEO laws as noted. The first question under this is, under the American with Disabilities Act and other federal employment non-discrimination acts or laws, may an employer require all employees physically entering the workplace to be vaccinated for COVID-19? Their answer, the federal EEO laws do not prevent an employer from requiring all employees physically entering the workplace to be vaccinated for COVID-19, subject to the reasonable accommodation provisions of Title VII and the American with Disabilities Act and other EEO considerations as discussed below. The next question is, what are some examples of reasonable accommodations or modifications that employers may have to provide to employees who do not get vaccinated due to disability, religious beliefs, practices, observances, or pregnancy? And again, it says they must be entitled to a reasonable accommodation that does not pose an undue hardship on the operation of the employer's business. For example, they may have to wear a face mask, work at a social distance from coworkers or non-employees, work a modified shift. Basically, there are alternatives. This webpage goes on and on and on. But again, I encourage you to get your information straight from the source. It'll clear up a lot of confusion. You don't have to post on social media and cause more drama, because there's already been a lot of drama over the last 2 years regarding, SARS-CoV-2 and COVID-19. I think it's safe to assume that as these businesses and these large corporations start to mandate COVID-19 vaccines, they're not going to put themselves in jeopardy of being sued. So they've already checked. Their lawyers, who make a lot more than I do, have already looked into this issue. Companies like the NFL, for example, they recently have made the news for requiring, or more likely strongly encouraging, players to become vaccinated. From what I've read, the NFL does not officially have a vaccine mandate for their players. Essentially, I think the players' union would have to weigh in on the legality of a COVID-19 mandate, because these players do have contracts, and depending on what's in those contracts will affect their terms of employment. However, the NFL does have the power to impose harsh restrictions and repercussions for players who are not vaccinated, and because of that, affect the livelihood of their coworkers, their fans, and the NFL as a business. I think we've come to the point where we realize that, yes, these vaccine mandates are legal. The next question, though, is, are they ethical? So just like with the NFL, when it comes to how to approach this, businesses have a responsibility to protect the health and safety of their employees, of their customers, and from that, they're able to enact these restrictions. When it comes to specifically healthcare facilities, again, they also have those legal and ethical responsibilities to protect their staff, the patients, and everybody that comes into the hospital. Back when COVID-19 was raging and just destroying the world, essentially, it hit healthcare workers the hardest. And as healthcare workers were taken out of circulation or had to self-quarantine, that put restrictions and really crippled the healthcare system, especially in our large cities like New York. And we saw the fallout from that. So fortunately, with this new vaccine, I think the numbers I read recently, almost 80 or 90% of healthcare workers have received at least one dose of the vaccine. And this enables the system to continue to stay open for other people, not just people suffering from COVID-19, but people that are having your typical heart disease, stroke, that need emergency care. So that is the importance of maintaining a healthy workforce. So it's always been legal for these hospital systems to have these different mandates for vaccines. The ethics absolutely is there, that they have this ethical obligation to continue to be able to function and care for patients. Now, it's not all sunshine and roses, right? Because these healthcare organizations, unfortunately, are probably more focused on maintaining a profit. And just like with the NFL and the businesses in New York, as COVID-19 starts to rise again in incidents, they're going to take a hit to their bottom line. And that's probably the incentive for these vaccine mandates, if you want to be real. And you can mandate your employers to do that, and then you're going to take less of a hit on your bottom line. When it comes to businesses, we already talked about colleges and secondary education. Again, those individuals and those organizations have the legal and ethical position where they need to protect their students, their student population, protect the environment, and they are well within their rights to establish these vaccine mandates. Recently in New York City, they have announced this new vaccine mandate. It's going to start in August 16th, and it will officially be enforced as of September 13th. And it's called the Key to New York City Pass, where you must be vaccinated and be able to show proof of vaccination to eat at indoor bars and restaurants, to go to other indoor events and places. And again, the question of, is it legal? Yes, obviously. The city of New York, I'm sure their lawyers went through the court system, looked at case law, all that stuff, before making this mandate. Is it ethical? Absolutely. Now, when it comes to the ethics of this, there's always a couple different ways to look at the ethical scenarios. From a utilitarian perspective, yes, this is the greatest good for the greatest number of people. Ideally, you're decreasing the spread and transmission of this deadly virus, and you're able to help encourage other people to get vaccinated. And overall, you're doing the greatest good for the greatest number of people. If you look at it from an individualistic perspective, where someone's autonomy is being infringed upon, sure. Yes and no. A little bit. Again, nobody is holding people down and forcing them to be vaccinated. That would absolutely be an assault upon one's person, upon one's autonomy. But we're not forcing anybody to get these vaccines, because we are all humans with our free will, and we have the ability to refuse. Again, with that decision or choice comes repercussions, and you need to know what those repercussions are before you make those decisions. So if you live in New York and you decide not to be vaccinated, as of September 13th, you will be restricted essentially from different establishments. And again, that's for the greater good of your fellow citizens in the city of New York. And interesting to note, so with this Key to New York City Pass, I guess they have a couple of different apps where you can have your vaccination status, or you can have your vaccine card. They're not going to enforce this currently for children those under age 12. I just can't stress this enough. When it comes down to it, you are not removing choice. Now, some of the health equity concerns that can be imposed with this is if there is not equal access to this vaccine, you are now discriminating against a portion of the population because they have not had the opportunity to receive the vaccine, and now they are being barred from integrating into society. And I've had some great talks with some of my brothers, Italo Brown, who does a lot of health equity work, Dr. Robert Drummond, Dr. Jamie Rutland. These guys are just geniuses when it comes to COVID-19. And we've had some fantastic conversations about this and the health equity concerns of the vaccine. And thankfully, we're starting to close that gap. Talking to Italo, there's a lot of work to be done still in disadvantaged communities and ensure that they can easily receive this vaccine. I know it's been out for months and months, but that is the nature of healthcare disparities, that if you don't pay attention, you're going to have some folks out there that are not receiving this vaccine, whether it's due to misinformation that is so rampant, people that need additional information, people that have questions that need to be answered, or people that just don't have access due to transportation issues or scheduling issues. And there are gaps that need to be filled. So this legislation or these vaccine mandates and barring people from certain establishments will have significant potential to impact some individuals' quality of lives more so than others. After everything, when it comes down to the vaccine mandates, we're not completely ethically free, right? So there's the concern that this could be inducing some form of coercion into the system, and we're coercing people to get this vaccine. And it doesn't quite apply. We're kind of flirting with that line, sure. But coercion, again, the definition in Webster's is the persuasion by force or threats. And when it comes to barring people from bars and restaurants, or barring people from employment and different job opportunities, it's not force or threats. The intention of these bans and these mandates is to protect the greater good. So it's coming from a place of altruism and beneficence. It's not coming from a malignant place or malevolence where we're trying to punish people per se, but people are spreading a deadly disease, and we have the responsibility as productive members of society to do what we can to help stem the spread. So what are your thoughts on vaccine mandates? I know they're probably coming soon to a place near you. The one hangup that I do have with this, and again, I've talked with Dr. Robert Drummond and Dr. Rutland about this extensively. For me, I would 100% jump on board once these vaccines are no longer on emergency use authorization and have a full biologics license application. I do think it's just a bit premature to roll out complete vaccine mandates. I think we have a fantastic amount of evidence that these vaccines do work to help decrease the severity of the disease caused by the virus SARS-CoV-2. And I think there's enough information to act. When you have a trial that shows it's extremely harmful or it's extremely beneficial, oftentimes they stop those trials early for the greater good again. So I think to dot the I's and cross the T's, ideally we would soon have this biologics license application where these vaccines are fully authorized by the Food and Drug Administration. So that is the one part that I'm not entirely on board with. But overall, I think this is going to do a lot to help stem the tide of COVID-19. So what are your thoughts about vaccine mandates? Are you for them? Are you against them? Does your employer currently mandate the vaccine? If so, or if not, would that influence your decision to take the vaccine? I'd love to hear from you. Again, my website, StephenBradleyMD.com. You can hit me up, send me your ethical conundrums. I would love to give you some feedback. I also host the Black Doctors Podcast, a show that tells the stories of inspiring healthcare professionals with the goal of inspiring the next generation. So definitely check that out. New episodes released every Monday on that show. If you enjoy what you're hearing, please help support me. Share this episode with somebody who's interested or concerned about vaccine mandates. please leave a review, leave a rating. This really helps the show get out there and reach more people. I love reading and talking about this stuff, and I love coming to you and sharing. Thank you so much for listening. Tune in next week to another episode of Curbside Ethics, the show that helps you make better ethical and equitable decisions for the benefit of your patients.